Well, stakeholders at the SATB conference in Durban say that TB can be eliminated through collaborative approach minus the silo mentality. Healthcare experts, civil society and government came together to examine why the current systems for testing and treatment are not yielding significant results. The 2021 Global TB report by the World Health Organization has noted an increase in TB deaths for the first time in over a decade. Let's discuss this further. We're now joined via Zoom by Professor Geoffrey Setswe, implementation scientist at Aurum Institute. Prof, a pleasure to have you on the show. Thank you very much for joining us, sir.
Thank you, Melidova.
Let's start here, Prof. Let's talk about some of the outcomes of this conference. I mean, one of the things that you were indeed to talk about was, why we remain having these high infection rates and the highest, in fact, at this time. And I can't help but to think that this is also then linked to the fact that, we were dealing with a pandemic. So were people paying less attention then to TB? And that's why, we find ourselves having more TB deaths for the first time in over an increase in TB deaths for the first time in over a decade.
Yeah, the conference has shown that a lot of work is being done for tuberculosis. There's a lot of research going on and there's a lot of interventions to try and end TB by 2030. But TB is obstinate because it is not only a medical problem, it is also a social, behavioral and economic problem. More people who've got tuberculosis are among people who are poor, who are hungry, the migrants, and people who come from poor socioeconomic environments. And so we cannot only deal with the medical issues that we see. When somebody says they cough, they've got headache, they've got all the symptoms of tuberculosis. We need to deal with the social and the economic issues that affect people. Poverty, malnutrition, and what we call food insecurity, the overcrowding conditions are the breeding grounds, for tuberculosis. And the high prevalence of HIV/AIDS in this country is also a source for tuberculosis in our country. And so many sessions at the conference were able to identify, the new technologies, and you can see with the pictures that there are new diagnostic tests, there are new medications, and there are new things, that are coming up. But it's not only the medical side of things that needs to be attended to. We also need to look at those socioeconomic factors. But there's also behavioral factors like tobacco smoking and alcohol consumption, and that the delayed health-seeking behaviors, particularly by men, that are causing, people not to respond well to treatment interventions that are available.
Yeah. Prof, you talk about the socioeconomic factors, and I actually want to zoom in on this because there's been, questions about, why people, for instance, don't complete their treatments. I think I heard the Deputy Health Minister talking about the fact that, and this is in relation directly to what you're talking about, the socioeconomic factors, where in some instances people cannot travel. They don't have money to travel to go get medication. There's all kinds of things that are causing, the interventions for TB to be stopped ultimately. And I wonder how these issues will then be sort of dealt with, because as you mentioned, we're not just talking about interventions from a health perspective, from a medical perspective. I mean, the fact that we have healthcare workers like yourselves, and experts like yourselves, civil society, government experts on health coming together, putting their brains together, surely, and the level of scientists that we have, surely, and as we know, TB is preventable. But when we talk about these socioeconomic issues, where do we even begin in addressing them?
Yeah, and I think that this is where we needed, with HIV/AIDS, and I always refer to HIV/AIDS, we started seeing it as a medical problem. And we put in all the big interventions, the drugs, the testing, and all those follow-ups. But later on, we realized that we needed to deal with the social and behavioral issues that are related to HIV/AIDS. And it's the same thing with tuberculosis, that we need to have a more comprehensive response where we look at the issues of tobacco smoking, how can we reduce that alcohol misuse and the issues of health services that should be efficient. We know that the private sector is not doing as well as the public sector when it comes to tuberculosis, that even the 16% of the population who have access to the private sector should be using, better services for tuberculosis. And so the health services need to improve. The situation that we saw recently with the increased prevalence of tuberculosis was also related to COVID-19. Remember when we had COVID-19 in 2020 and 2021, we closed hospitals and people were kept away from the public healthcare services. And as a result, many people who were supposed to take their treatments did not take their treatments and do other measures, to seek care. But we still have other issues, that include, poverty and inequality. We are a country where there is high levels of inequality, and those issues need to be dealt with as part of the broader socio-economic development of our country. The issues of overcrowding, in the many squatter communities that we have in our country, and overcrowding in taxis and overcrowding in the trains and buses. We need to deal with those issues, that there is a well-functioning housing system, a well-functioning transport system, and issues of poverty are dealt with. There are elements of social measures that are being implemented, like the social protection measures, where people are getting different forms of grants. We know there's more than 12 million people, maybe 17 million or even 18 million people who are getting some kind of social support in this country. It reduces the level of poverty for those people, and it's just one element of dealing with the issue. But people need, a healthcare system that's functioning well. They don't want to go to the clinic only to find that the clinic is running short of staff or is running short of medication and things like that. So it is those kind of things, the basics that we need to attend to, that involves the social life that we have and the economic situation.
All right. Prof, it was a pleasure talking to you. Thank you very much for speaking to us here on SABC News, sir.
Thank you, ma'am.